Hello, I've been working for 3 years already. So, for the first 2 years of my working experience, I actually worked in the pediatric setting. And in those 2 years as well, I'm still working as a home occupational therapist. And now, ever since last year, June of 2024, I was working as a hospital based therapist and I'm still doing home care as of now. So that's the entirety of my 3 year experience as an occupational therapist. And in those 3 years, even though the clinic that I first worked at for the first 2 years of my experience was mostly handling pediatric patients, we also had some adult patients as well, but it was mostly physical disabilities and some were neuro rehabilitation such as stroke and traumatic brain injury, and but mostly my clientele during that time were pediatric clients, so children with developmental delays, intellectual disabilities and whatnot, children with autism spectrum disorder or attention hyperactivity disorder. So those are the bulk of my clientele during the first 2 years of my experience. And now, as a hospital based OT, I've been working with a lot of individuals who've experienced stroke, traumatic brain injury, some individuals who've experienced spinal cord injury, and some individuals who have been amputated in one arm or bilaterally. So that's my experience so far. And I also work with the elderly, but that's mostly for my home care patients. So in my first 2 years of working, I worked in Goal Pediatric and Adult Therapeutic Center, and majority of my patients there were pediatric patients. And after my 2 years in Goal, I moved to a hospital called Southwestern University Medical Center. There, I'm working mostly with adults in that setting, and I get to treat a lot of patients who have physical disabilities. And while I was working in Goal and up until now that I'm working in the hospital, I also do home care. But for my home care patients, it's mostly geriatric or elderly patients. So these are patients who have limited mobility and are hard to transport from their home to the hospital. So that's why I go to their homes to give them therapy. And I've also dabbled in some mental health work, so I've also tried working with patients who have had depression, bipolar disorder, but I would say that I'm more well versed in patients in the pediatric and physical rehabilitation area of practice. So that's more of what I've experienced treating in my 3 years of experience as an OT. And for my bachelor's degree, I graduated from Velez College under the 5 year curriculum for occupational therapy. And but that was in June of 2020. So after that, I took the board exams last December 2021. It actually took me a long time before I could take the board exams because of the delays due to the pandemic. After the board exam, I was volunteering for around 3 months, and my first formal work was in April of 2022. So that was when I first worked in Goal Therapeutic Center as an occupational therapist, mostly handling pedia, but occasionally handling the adult population. And then after that, I worked in a hospital setting, which is in Southwestern University Medical Center. And there I'm an occupational therapist for a variety of cases in the physical rehabilitation and neuro rehabilitation area. So those are my qualifications and my professional and educational background for occupational therapy here in the Philippines. So I've had over 3 years of experience, and I've also done home care, but mostly for elderly patients. I'm motivated to pursue an occupational therapy career in Australia due to the overall climate and culture of Australia, which is having a company culture or a work culture of being more quality focused than quantity focused, because I understand that in some countries they're really more KPI based, and sometimes like quality care can be overlooked in order to achieve higher numbers in terms of like quotas and stats. So it's a bit similar here in the Philippines, especially in the pediatric setting, wherein it's nice if you have more patients in a day, but it's somewhat compromises the quality of the care that you're able to provide for your patients. So I really value providing quality care to the patients that I treat while simultaneously maintaining my own well-being and mental health in at the same time. So I value having a good mentorship also, and I value being able to pursue professional development after work. So I want to be able to pursue other educational pursuits, which I know is something that is very important there as well.